In this ESMO GA meeting, I present some information about the newer HER2-targeted therapy as an educational presentation. Until now, we only have 2 agents for HER2-positive disease, including Trastuzumab and T-DXd, and this is less than breast cancer treatment. And first, we have an intratumor heterogeneity in gastric cancer tumors. It is quite common phenomenon in gastric cancer compared with breast cancer. So as a result, around half of patients show reduction of HER2 after trastuzumab. This is one unique aspect of gastric cancer. And also, heterodimer between EGFR and HER2 is important for incomplete HER2 blockade by trastuzumab. So overcome this EGFR HER2 heterodimer is also another important aspect. Also, activation of downstream pathway by HER2 mutation or downstream pathway mutation, as well as unrelated pathway alteration like MET, are all relevant resistance mechanisms. So how we can overcome this resistance mechanism? First, we can use combination with chemotherapy and ADC agents with bystander effect to overcome intratumor heterogeneity. And one of the exciting areas is bispecific agent like zanidatamab or one Chinese similar agent. And also combination with immunotherapy also showed activity in KEYNOTE-11, so to combine with the newer types of immunotherapy is also interesting. And combination with HER2 TKI or some other pathway like MET are also interesting. So first, zanidatamab already shows a benefit in global phase 3 trial, and hopefully it may change the standard of care in the near future. Although the diarrhea management is required, but it could be the preferred first-line option because of the large magnitude of benefit. And this is also important for EGFR and HER2 heterodimer formation because zanidatamab can block heterodimer formation because of the HER2 clustering. And same could be true for HLX22 as a new HER2 agent as a monoclonal antibody with different epitope for binding compared with trastuzumab, although it is bind within the same domain. This combination with HLX22 and the trastuzumab induces rapid internalization of a homodimer or heterodimer with EGFR, and it showed quite encouraging activity in previous Chinese study, and currently phase 3 study is ongoing. Also, ADC like T-DXd combined with a checkpoint inhibitor with other cytotoxic chemotherapy also showed some promise in previous phase 2 study, and these combinations are being tested in global phase 3 like DGO5 and Ultimate study. And also other new types of combination like T-DXd with zongertinib as a HER2 TKI, EGFR targeted agent, or newer mild checkpoint inhibitor are being tested. Also new types of ADC such as bispecific ADC or ADC with new payload or bispecific payload have been extensively tested. But I think not only this new agent, but also more understanding of tumor biology should be also important for us to improve our patient outcome. So, for example, more stratification by biomarkers, reassessment of biology through treatment period, and more understanding of resistance mechanism of each component. So maybe we need more research, but overall we have a quite promising HER2-targeted agent and ongoing research which hopefully improve our patient outcome.